about to listen to the Dr. Daliah Show. Sassy, stimulating medical talk radio. Any medical advice Dr. Daliah Wax gives on her show should not be substituted for an actual visit to your medical provider. And now, here's Dr. Daliah.
All right, we are back on the Dr. Daliah Show. Thank you all for tuning in. 1-877 Dr. Dali, 1-877 DOCDALI. I apologize. I drank down the wrong tube. Drinking down the wrong tube, that's always a fascinating concept. It's also an improper term, but it's when your epiglottis that is supposed to protect your trachea. Food goes down the esophagus, epiglottis covers the trachea so food doesn't get into your breathing windpipe, and then it flips back so you could breathe. And sometimes when you drink, there's some backsplash, and unfortunately, if at all we think a little bit of fluid is irritating the respiratory tree, you end up like me, where you start coughing on air. So thank you. Just bear with it now. Okay, so here we go. Now, children and obesity. I am being asked time and time again, when can we start giving kids weight loss drugs? I don't think that's a good idea. Kids are not necessarily, as a whole, the pediatric population. We are not ready to start engaging them and committing them to possibly years or decades of weight loss drugs. I am a huge advocate of getting intervention immediately. Obesity in kids is wrought with physical health ailments, but mental health ailments, psychological. We have got to help this population. So what do the experts say? So there's an expert panel, according to the U.S. Preventative Services Task Force. They have updated their final recommendations on how primary care physicians could help children with high BMIs, and they have suggested extensive and intensive behavioral interventions, such as 26 hours of behavior coaching. Now, the recommendations suggest that we provide these interventions for children who are at least 6 years old with a high BMI, body mass index. Now, what is a high BMI? Well, according to their definition, even though we still use height and weight, a BMI of 30 or higher is for adults, is the obesity range for adults. But a child is considered to have a high BMI if they fall at or above the 95th percentile for their age and sex. So if a child's BMI is higher than that of 95% of other kids in their same age and gender, they are considered of high body mass. So they want self-monitoring, goal setting, supervised physical activity, instruction in a healthier eating, limits on screen time. And the intervention should involve at least 26 hours in a calendar year and include supervised physical activity. So, all right, well, diet, exercise, and supervised care, therapy, 26 hours in a year. I think we could do probably a little more than that. But what is the practical? What practically can we do? Because many parents have a child or a niece or nephew or a grandchild who is off the curve with that. And everybody is so afraid to fat shame or make them feel biased, and nobody wants to say something. I remember when I went through puberty and I got some curves, I remember my grandmother said, "Your butt's too big." I was like, "Yeah, Grandma." That's how the women talked to each other in the family. Your boobs got big. Yeah, they did. Are you wearing the right size bra? I don't know. I was a training bra last week. You need a bigger bra, girl. And that's how the women in my family talk to each other. All right. It was nowadays it's, okay, I need to sit down and talk to you. Okay. Your body image is beautiful. You are who you are. And we may want to augment some health benefits to your new size. I mean, it's just, okay, if you're gaining weight and we're having a weight issue, we need to handle it. And I don't want children biased or put in this box and labeled. But if a refrigerator is broken, it's broken and we got to fix it. If you're pregnant, you're pregnant. If you have diabetes, you have diabetes. We need to address it. If you broke a nail, you need to address it. If your weight is rising, we need to address it. And because we are so worried about what to say, we're letting it go. And we're letting it go. And we're letting it go. And these kids are becoming unhealthy. And you think you're helping the kid by not bringing it up, but you're not. When I heard that doctors were being accused of fat shaming for bringing up weight to their patient, I'm like, what? Well, then if the doctor isn't going to bring it up, who is? Your plumber? I mean, come on. Somebody has got to bring up the health metrics. If you have bad breath as a patient, your doctor needs to tell you. If not, that's a misdiagnosis. You may have periodontal disease. You may have acid reflux. You may have strep. Okay, we're going to have to say something. Your breath has a different odor than what normal breath has or what your usual breath might have. That might be a sign of acid reflux, bacteria. I mean, that's what we're supposed to do. If somebody has a high BMI, you don't call them fat. That's not a proper term. But you say, look, let's look at your height and weight. Let's see patterns. We see that diabetes, high blood pressure, heart disease, you might be at more increased risk based on this. What can we do to get you into the lower risk range? It's not fat shaming, people. I understand everybody gets triggered these days, but if a doctor doesn't do a job, they lose their license. So we have to do our jobs. So what about weight loss drugs in kids? My only issue with that is we cannot teach kids you always go to the pill. There are children that have genetic basis for their weight, and they may need intervention. They may need bariatric surgery. But if we have a child with poor food choices or their parents are not feeding them fruits and vegetables, but letting them eat soda pop, ice cream, cookies, no, we don't want to do surgery on these kids. We don't want to do weight loss drugs on these kids, which means if we're going to be doing intervention and education, we need to get the parents in there as well. So, obesity could be very metabolic, endocrinologic. It could be psychological. It could be a medicine they're on. A lot of people are taking medication. But if a child is gaining weight or they're turning to food, we need to also know why. Is it depression? Is it anxiety? Why are they turning to food? And we got to get our kids to exercise more. 1-877-DOC-DALI. Don't go away.
Considered by most, optimized curcumin is one of the few bioavailable and highly absorbable curcumin products on the market. Hi, I'm Dr. Mitch. Since most chronic diseases have inflammation, our optimized curcumin seems to be a perfect addition to any nutritional program. It makes sense to me that preventing or reducing inflammation is a key component to our overall health. The Mayo Clinic found that curcumin can decrease swelling and inflammation, has antioxidant properties, and research suggests that curcumin can prevent cancer, or at least slow the spread of cancer, and in many instances make chemotherapy more effective. It protects our healthy cells even from radiation. TotalWellness.com, where we help you to look good, feel good, and enjoy total wellness.
Self-reliance. It's not a phrase we hear much in our culture these days. It might conjure up images of pioneers, the West, rifles, strapping men, and strong women. But what does it mean for us in today's world? The New American Magazine has just released its latest collector's edition, Self-Reliance, Foundation of Freedom. In it, the New American authors outline the necessity of self-reliance for a free people, tips for self-reliant living, and the importance of not giving up hope. This unique edition includes articles on the self-sufficiency of the founders, preparing for a worst-case scenario, firearms, financial self-reliance, the importance of community, and many other topics by expert writers. Now, for a limited time, the New American is offering a bundle of 3 collector's editions, Self-Reliance, The Great Reset, and Trump World, for just $19.95. Available at shopjbs.org. Visit shopjbs.org today.
All right. We are back on the Dr. Daliah Show. Thank you all for tuning in. 1-877-DOC-DALI, 1-877-DOC-DALI. Big thanks to Talk Media Network for making the show happen, and big thanks to our producer, Daniel, who is everything for the show. Okay, so you guys have heard of hepatitis A, hepatitis B, hepatitis C, hepatitis D, hepatitis E. Yeah, there's hepatitis E. Hepatitis is a viral illness that affects the liver. Well, it can also be spread sexually. You could spread hepatitis B sexually. You could spread hepatitis C sexually. But we are hearing that we need to be on the lookout for hepatitis E, because not only can it spread sexually, but it could cause infertility in men and affect sperm count. So for those of you thinking, look, I'm just going to get the clap, at worst, I'll get some gonorrhea, chlamydia, take an antibiotic, I'm good. No. STDs, STIs can be deadly, can have a lot of complications. So you need to be careful. All right. So hepatitis E worldwide is one of the leading causes of liver infections globally now. It is also endemic in pigs in the United States. Now, after inoculating pigs, this is a study out of Ohio State University. They wanted to look at the infectivity and what it does to the reproductive anatomy, because pig reproductive anatomy mimics humans. They inoculated pigs with this hepatitis E, and they found that the virus circulated in blood, was shed in the feces, meaning the pigs did get it. That means it went through the body. They had no clinical symptoms, but they found it on the head of sperm cells. So they say that their study is the first one demonstrating that it can affect the sperm cell. Our future studies will be directed towards understanding the association between the hepatitis E virus and the sperm head. Sperms have heads. Then they got the little flagella tails. And they are going to look at animal models to see whether sexual transmission of the virus is happening, because in the human setting, it's still an evolving science. So what this study has shown is, one is the virus will go straight to the testicle and get to the sperm. Two, if it's on the sperm head, then sperm will can very easily be transmitted to sex, male to male, male to female. And then we need to study what happens if that hepatitis on the sperm head, what happens to the individual? Will it then infect? Could it affect the fallopian tube? Could it affect other sperm? What could it do? Well, especially if it goes into depending on, will it, if it is on the head of the sperm, could it affect the other sperm? And it's that sperm's motility and its functionality. For a sperm to be effective, it has to be fast. It has to be able to swim. It has to have strong motility and have a sense of direction. For you to get pregnant, or for somebody to get pregnant, the sperm has to not only get into the vagina, but it has to go up the canal, which can be a pretty long trek. It's a pretty long trip. Okay, they need to charge at least overnight for this one. Then they need to make it into the cervix. You're going to hit the uterus pretty hard, but there's an opening in the cervix, a little baby hole. They got to get to that hole and get into the cervix. Now, the cervix could be this long. They need to travel that as well. And mind you, they're microscopic. Then they get into the uterus. But just because they're in the uterus doesn't mean much. They need to get into the fallopian tube and hit that egg as the egg is on its way down. So they need to get to the part of the fallopian tube, which then later connects to the ovaries. The ovaries is where the egg ovulates, gets into the tube, and then the egg and sperm meet. Once they meet and they have a fertilized egg, zygote, it comes down, lands in the uterus. Hopefully progesterone is making a nice, comfortable home. Period will stop so you don't slough off that home. And then the zygote turns into a fetus. Fetus grows, baby. So, the STDs that we are seeing, I don't think we know of every single STD out there. Is this relatively a new one? No, it might, when we have men with fertility issues, we might not know the whole reason. When we have females with fertility issues, it could be that this has been happening for a while, or maybe it won't affect fertility to that degree. But what we can say for sure is STDs are on the rise. And because I work with telemedicine, I see time and time again, somebody call in saying they think I have an STI or an STD, sexually transmitted disease, sexually transmitted illness. And when you look back, they had called a few days prior for a UTI. I'm having burning when I pee. And we are treating people for UTIs without confirming what they have. And if somebody thinks they have a UTI, they may not continue to have protected sex. If anybody has had unprotected sex, we as a medical industry recommends you get tested, you get screened, and often. And we also recommend to stop that. Use condoms. Protect yourself. These STIs are very smart. If you thought COVID was smart, you ain't seen nothing yet. These STDs have nothing better to do than to thrive. And they know how to get to where they need to go. HIV, one of the smartest viruses out there. What's a stupid virus? Okay, well, let's compare HIV to a stupid virus. A stupid virus, to me, is a virus that once you get it, it's pretty well known. You know you got it. So, like, let's say you get rhinovirus or a type of adenovirus or coronavirus. You're sneezing. You're coughing. You might be throwing up. You might be having diarrhea. Your body is expelling it. And then the virus dies off in 5 to 10 days. Okay, not the very sleuthy, sleek, stealth virus. Then you got the intermediate, smarter viruses, like hepatitis. Hepatitis, B, C, could get into your cells, lay dormant, decide to stay active, but knows how to kind of stay alive for a long period of time. Herpes, pretty smart, knows how to stay alive for a long period of time. But they're not super duper smart because when you get them, you can tell sometimes. You get herpes, you know, you got blisters, etc. Whether they're cold sores or genital lesions. But HIV, super duper smart. HIV, you may not know for months that you have it. Also, HIV, as opposed to some of the stupid viruses that hit the sinuses or the GI tract that could expel it, HIV hits the one cell that could fight it. The T cells, your immune system. It doesn't necessarily want to infect your nose, doesn't necessarily want to infect your GI tract, but it hits right away your T cells, the one cell that could fight it. Also, it decides to get to you in a more fun path. All right? Sex, drugs. And then HIV also knows how to hide. We have found that it might also affect the macrophages too, not just the T cells. So these viruses are learning to become smarter and more stealth so that they could survive. That's all they have to do. You and I might have to go to work. We might have to watch House of the Dragon on Netflix, but no, or HBO Max. But these viruses, all they have to do is live to survive. So if you are having sex and you are not using protection, you need to check for HIV. You need to check for syphilis, gonorrhea, chlamydia, trich, herpes, hepatitis, and a range of hepatitises. STDs isn't just all about HIV. STDs isn't all about gonorrhea, chlamydia. Now, some of you are frustrated because you try to use telemedicine. You're like, my girlfriend has chlamydia, so just give me an antibiotic. We can't do that. Because these are reportable and the CDC needs to know the numbers, you have to go in, you need to get tested, you need to get treated. There's been some debate on if you need to be checked for cure. I recommend that. I recommend that you be tested for cure because you want to know it worked. Now that we have drug-resistant gonorrhea, drug-resistant chlamydia, you want to know that whatever you took knocked it out, especially if you're not using the safest sex practices. Please do use the safest sex practices. And I get you might be in a monogamous relationship or a relationship where you think it's monogamous. And many STDs that I have diagnosed in patients were in married people who thought their spouse was monogamous with them. So, of course, they were having unprotected sex. Married people can have STIs. They can. And so if you're having burning when you pee, get a urine test, get it confirmed. And if it's not a UTI, you need to then get tested for STIs. Now, there's other things that also cause burning when you pee, interstitial cystitis, peppery food, COVID can cause vaginal burning, urethritis. There's autoimmune issues that could cause it. But I think we are missing diagnosing STIs. And I think we have an epidemic of it because people think all they have to do is take an antibiotic. 1-877-DOC-DOLLY. Don't go away. Dr. Daliah here. Are you tired, burned out, gaining weight, succumbing to the daily pressures of life? Well, how's your dopamine doing? How you feel right now, how you'll feel an hour from now, and how you'll feel next week is completely reliant on your dopamine. Our daily motivation and willingness to push through challenges depends on the intricate chemical process dopamine provides. Christian Kalikas and I created Deploying Dopamine, a book that tells you what dopamine is, when it dysfunctions, and how to successfully deploy it when needed. Find Deploying Dopamine on Amazon today. Check it out.
Carl Amari here to tell you about our newest website for old-time radio lovers. It's 100radioshows.com. At this site, there are 5 old-time radio shows waiting for you to download free as our gift to you, and be sure to browse the additional 700 old-time radio shows available to you for 70% off by using the promo code RADIO at checkout. This is a limited-time offer, so log on to 100radioshows.com. That's 100radioshows.com.
All right, we are back on the Dr. Daliah Show. Thank you all for tuning in. 1-877-DOC-DOLLY, 1-877-DOC-DALI. So, while the country's a little bit nervous about what's going to be happening this next election and the state of our commander-in-chief, the White House, doing something very similar like what they did during COVID, tried to be the misinformation police. And what they call misinformation is not misinformation. I've said that time and time again as it pertains to COVID. I thought it might have been leaked from a lab. Only now, 5 years later, they're talking about it. But before, that was considered misinformation. Your dirty masks that you're wearing in your pockets and aren't hazmat grade N95 masks might not be protecting you against the COVID virus. That was deemed misinformation, originally called no, that was true. They are not very effective at preventing COVID. Gets through, and you're breathing it out. Well, now, in terms of the sightings of Biden and hit the videos where it looks like Obama had to kind of take him by the wrist. You usually don't see former presidents grab other presidents by the wrist to try to walk them off stage. And other videos that it looks like Biden is meandering. Karine Jean-Pierre, White House press secretary, basically accused the Republicans of cheap fakes and deep fakes. Now, I think she retracted the deep fake, but when the reporter asked about a rash of videos, Jean-Pierre said, yeah, and I think you all have called this the cheap fakes video, and that's what they are. She said they are cheap fakes video done in bad faith. She said some of your news organizations have been very clear, have stressed that these right-wing critics of the president have a credibility problem because the fact checkers have repeatedly caught them pushing misinformation, disinformation. She says, and so we see this, and this is something coming from your part of the world, calling them cheap fakes and misinformation. She said she'll quote the Washington Post where they wrote, Republican used misleading videos to attack Biden in a 24-hour period. Now, I think that also later got retracted. She said, ironically, several recent cheap fakes actually attacked the president for thanking troops. She said, that is what they're attacking the president for. Normandy, this happened again in Italy. And I think that it tells you everything we need to know about how desperate Republicans are. And instead of talking about the president's performance in office, legislative wins that he's been able to do for the American people across the country, we're seeing these deep fakes, these manipulated videos, and it is done again in bad faith. So, okay, in the media, I understand, and I think she did, go back and say, look, all right, I didn't mean deep fake. Deep fake is where you have AI computer generated. Okay. These, none of those images were computer generated. It was multiple, videos caught the president with what looked like he was meandering. I have seen unedited videos. You have to be very, very careful in the media. They do this to Trump all the time, where he says one word. And if you actually let him finish his sentence or finish his thought, you see it means something else. And so, yes, I think manipulation, and I think many media outlets are trying to shy away from that now. You look so bad when you're caught, where somebody is misquoted and the video catches you say the wrong thing. I think now that there is so much evidence to show the full quote, I think many media organizations now are doing their ethical duty to make sure that they aren't cutting and pasting or manipulating an edit. But when you see these videos that are long running and Biden freezing, which is a form of akinesia, which we spoke about yesterday, I don't want there to be a lack of transparency. I don't want there to be cover-ups. There's a big demand that our current commander-in-chief, who is running to renew his job as commander-in-chief, to be out there and to let people see for themselves what his mental status and cognitive status is. It's going to be fascinating to see next Thursday. I believe it's next Thursday, the debate between he and Trump. And I know a lot of people are worried about it. It's going to be through CNN, which may temper and protect Biden a little bit more. They will probably shut off Trump's mic. And I think there's going to be a lot of staging and choreography. But still, Biden will be taking the mic, hopefully alert enough and able to answer questions off the cuff, although I think the questions are probably prepared. But the problem I have as it pertains to medicine and politics is this jumping right to misinformation. Cheap fake, deep fake, bad faith. If a journalist is reporting the news and showing a video of somebody just staring and frozen, okay, if they didn't show it, isn't that bad faith? We are trying to pressure people and threaten people to not say something. Look at how doctors stayed silent. You had begged doctors to at least have a conversation about natural immunity. Have a conversation about this being a virus that could have been tinkered with or leaked from a lab. You begged doctors to have a conversation about masks because your asthmatic child did not want to cover up their nose and mouth when they were struggling to breathe. And doctors stayed silent. When people ask, could the Holocaust happen again? Absolutely. Look at how everybody stayed silent during COVID. Look at what's happening right now with Israel and hostages still being attacked and raped and held. And people stay quiet. And the government knows how to silence you, how to scare you. Now they're going to be using this term cheap fake so that you think what you're seeing is fake. If our country is that concerned that anything they see isn't real, you lose them. They talk about democracy being at risk if Trump gets elected. Democracy is at risk if you don't think your vote counts. If you think elections are manipulated with. If you feel threatened by being one political party or another, if you feel like you can't be yourself, if you feel like you're the bad guy, if you feel like no matter what you do, you're called racist, you're called evil, you're called bigoted, misogynist, homophobic, even though you're not. If you feel like America doesn't represent you and doesn't want you, that's where democracy falls. When America makes you feel like you don't belong because you support one political candidate over another, then that's not America. America is supposed to embrace all political candidates. You are supposed to have a choice. You should have a choice of religion. You should be proud of your faith. You should be proud of your race. Just because you're one race doesn't mean you should be discriminated against. That's what America's values are for. And it's right now, you're accused of misinformation. You could lose your job. Called a conspiracy theorist. You're accused of spreading disinformation. They make it a crime when actually you're just kind of telling the truth. Guys, natural immunity may play a role. And it kills me to see what happened over the last few years. And you saw me struggle. I'm like, I don't want to lose my license telling you guys the truth. And I was right. And, there was that threat because I couldn't be there for you if I wasn't a doctor. And doctors were afraid to speak out. They wanted to play it safe because they wanted to keep their jobs. So did politicians. So did public health officials. Fauci wanted to keep his job. And you have to do the right thing. If our commander-in-chief is struggling and Americans see it, then other world leaders see it. Look at how many criminals have been crossing the border and have gotten caught or have not gotten caught. I think we just had another girl that was attacked. People know that our commander-in-chief is struggling. Where's the transparency? Don't be accusing people of fakes. 1-877 Doc Daliah.
Considered by most, optimized curcumin is one of the few bioavailable and highly absorbable curcumin products on the market. Hi, I'm Dr. Mitch. Since most chronic diseases have inflammation, our optimized curcumin seems to be a perfect addition to any nutritional program. It makes sense to me that preventing or reducing inflammation is a key component to our overall health. The Mayo Clinic found that curcumin can decrease swelling and inflammation, has antioxidant properties, and research suggests that curcumin can prevent cancer, or at least slow the spread of cancer, and in many instances make chemotherapy more effective. It protects our healthy cells even from radiation. TotalWellness.com, where we help you to look good, feel good, and enjoy total wellness.
Self-reliance. It's not a phrase we hear much in our culture these days. It might conjure up images of pioneers, the West, rifles, strapping men, and strong women. But what does it mean for us in today's world? The New American Magazine has just released its latest collector's edition, Self-Reliance, Foundation of Freedom. In it, the New American authors outline the necessity of self-reliance for a free people, tips for self-reliant living, and the importance of not giving up hope. This unique edition includes articles on the self-sufficiency of the founders, preparing for a worst-case scenario, firearms, financial self-reliance, the importance of community, and many other topics by expert writers. Now, for a limited time, the New American is offering a bundle of 3 collector's editions, Self-Reliance, The Great Reset, and Trump World, for just $19.95. Available at shopjbs.org. Visit shopjbs.org today.
All right, we are back on the Dr. Daliah Show. Thank you all for tuning in. 1-877 Doc Dali, 1-877 DOCDALI. So Japan is reporting a spike in cases of a flesh-eating bacteria. We've got to be very, very careful with some of these stories because we don't want people freaking out and not going to Japan. I can't wait to see Japan. Beautiful country here. I need to save up on some money before I could go, but not planning anytime soon, but I do want to see it. But this broke. Bloomberg is reporting a rare flesh-eating bacteria that could kill people within 48 hours. Is allegedly spreading in Japan. And they say it was after the country relaxed COVID-era restrictions. Now, come on. At some point, we have to go back to living life. And they say that cases of streptococcal toxic shock syndrome, STSS, reached 977 cases this year by June 2nd, higher than the record 941 cases reported for all of last year. So less than 6 months, they've already superseded last year's numbers. This according to the National Institute of Infectious Disease. They've been tracking illnesses of the disease since 1999. Now, Group A strep can cause sore throat, strep throat, but some types of Group A strep can cause very severe bacterial infections, limb pain, swelling, fever, low blood pressure, necrosis, breathing problems, organ failure, and death. And they say people over 50 are at higher risk of Group A strep. One of the reasons why we became so obsessed with antibiotics is because of Group A strep. We were so worried about the ramifications of strep and the spread of it that our attitude is we have a tool, let's knock it out. And parents continually people call, I have strep, I need an antibiotic. They are so fearful of having strep. We have sadly caused such resistance with our antibiotics because many people had COVID or a virus or mono and improperly diagnosed because they weren't swabbed. And so, we need whatever tools we have, our antibiotics, to do their job, and we cannot be wasting it on non-strep cases. Why? Because of this. According to Ken Kikuchi, professor of infectious disease at Tokyo's Women's Medical University, says most of the deaths happen within 48 hours. As soon as a patient notices swelling in the foot in the morning, it can expand to the knee by noon, and they could die within 48 hours. Other countries have experienced recent outbreaks. In late 2022, 5 European nations reported to the World Health Organization an increase in invasive Group A Streptococcus IgAS disease, which also includes STSS. The World Health Organization said the rise in cases followed the end of COVID restrictions. Well, I'm not going to blame the end of COVID restrictions. There's only so much you could do when you're living in a bubble. But why would we have higher numbers? Is it because the bacteria had a chance to evolve? Is it because our immune system is down? I notice that if I'm working a lot and I'm indoors, or let's say I'm sick or something, stomach bug, so I'm kind of indoors, although I'm always working. I'm always out and about, but still. I notice after a few days of being in the house, I feel weaker. I'm like, I need to get out. I need to be. So a year or two of this, I do think our immune systems are down. The only problem is, these things can be pretty scary. At the current rate of infections, they say the number of cases in Japan could reach 2,500 this year. What's the mortality rate? 30%. So Dr. Kikuchi urged people to maintain hand hygiene, hand washing, treat any open wounds. You might carry it in your intestines, which could contaminate your hands through feces, so you have got to wash your hands. But I have been seeing an uptick in people calling telemedicine. I closed my office in 2016 after Obamacare and the deductibles, and people weren't and couldn't pay their $30 or $25 or whatever their balance was because insurance said, sorry, deductible, they have to pay. I've been doing telemedicine. And I've been getting people calling with some weird infections. And I'm like, were you bit? Like, no. Were you scratched? Did anything break the skin? No. Meanwhile, they look like they have cellulitis or an infection along the layers of the skin. And so I say, look, we need a better diagnosis. This could be, and rapid. They go, I woke up with this and it's getting worse. Get to a hospital. Sometimes oral medicines might not do the trick. If you have any rapid infection, you need to hustle. Because waiting at a pharmacy for a couple hours, then hoping the pill you take that dissolves in your stomach, that takes a couple hours, goes through the liver to finally address the infection. By the time an antibiotic might start to kick in hours later, the infection could spread. You got to get seen. What could a hospital do? They could do an IM injection, which will work faster, or even IV antibiotics. So any sort of redness, swelling, pain, inability to walk, inability to move a joint, something doesn't seem right, fever, get yourself checked out immediately. 1-877-DOC-DOLLY, 1-877-DOC-DALI. So making headlines is, I guess, Kevin Costner casted his son in a show. I think he has a show, Horizon. It looks like a Yellowstone spinoff, but I think it's different. And I haven't watched it because I'm a little westerned out, with the whole Yellowstone stuff. I think I've seen enough westerns, and it's good. But apparently he cast his 15-year-old son, Nathaniel Kittredge, in the movie. And he has gotten a lot of flack for it. And he defends his move to cast his son. He says, I realize there are so many young actors out there that it would just kill to be in this movie. And I do not want to take those parts away just because I place my own children in them. But you know what? Even though the movie has not been rated very well, and it might be a good movie, I don't know. I mean, they're rating The Boys really well, and The Boys has, from what I hear, has been pretty bad. I just barely started watching the second episode, and they're really not even keeping to the story because they're putting so much sex and sexual words and sexual acts in the show. So, sometimes I take reviews with a grain of salt. But if you're a parent and you want to help your child, I think that's fine. We want to teach our children to do things on our own. But giving your child an opportunity, I think is fine. If they stink, you need to, again, not let other people not be able to take that job or take that role or whatever. But if, you as a parent, you have one job on this earth, to make sure those kids are self-sufficient and could support their family. And so I don't have any problem with a parent trying to help a child. I do have a problem when it's going to be the death of a company, or that child is or that person is very inept, abusive, toxic. But, we've been helping our Gen Zs and our Generation Alphas differently than the way Gen X's were raised and baby boomers were raised and millennials were raised. And there's been a lot of debate on they need to, because how I moved out when I was 18, supported myself, worked multiple part-time jobs, walked until I was able to pull money together to buy a used car with no air conditioning. And I just tried to, make ends meet. I remember only having $6 for groceries for the week, and I made that last. I was skinny, but I made it last. And so I feel like all kids need to go through what I went through so they would, learn the ropes, learn the streets, understand how to, make ends meet and do what you need to do. But it's a different world out there. And a lot of us are helping our kids more than we got help, or even I didn't even want my parents' help. So I'm okay with it, as long as the person has the talent. 1-877-DOC-DOLLY. Don't go away.
Did you know that healthy arteries make a gas? Yes, actually 3 known gases. Hi, I'm Dr. Mitch, and nitric oxide is a gas that's readily made all day long to keep our arteries open by relaxing the blood vessel walls. By doing this, our circulation is increased, bringing blood, oxygen, and nutrients to every part of your body. Both age and poor diet can lead to a loss of this precious gas, and in turn, blood pressure can go up, energy can go down, and you can get tingling in your hands and feet. Well, our product, Ultimate Nitric Oxide, can easily help fix this lack of nitric oxide. Go to TotalWellness.com. That's TotalWellness.com, where we are helping you to look good, feel good, and enjoy total wellness.